Hello, I'm Jasmine Kaur with the National Library of Patient Rights and Advocacy. And today we are honored to speak with a distinguished expert whose extensive background spans an Associate of Arts in Psychology, multiple Bachelor in Science degrees specializing in Christian psychology, crisis counseling, and life coaching, along with a Master's of Arts in Human Services Counseling focused on addictions and recovery. Currently, he's pursuing a PhD in higher education administration with a focus on educational leadership. He's also a board certified pastoral care counselor, Christian counselor, and a life coach with a wealth of certifications and experiences. His interdisciplinary approach uniquely blends psychological insights with Christian perspectives, providing profound insights into marriage, divorce, and faith. We're pleased to welcome Dr. Lorenzo Barr. Welcome, Dr. Barr.
Thank you, Dr. Jasmine. How are you today?
I'm very well. Thank you so much for sparing time for us.
Okay.
I am really thrilled by all the expertise that you bring on the table. And can you please enlighten the audiences on the most important rights that patients have when receiving mental health care, and how do you ensure that these rights are upheld in your practice?
Well, patients are people that we have to treat with care. And when you have patients that come to you or people even from the church that comes and have problems that they want to talk to you about because of the field that you have studied, I personally feel that you should treat them one with respect, treat them with care, and you should also make sure that you inform them of their rights and let them know that whatever is being discussed here is between you and I, and it is confidentiality because you have to make sure that those documents are presented and signed for confidentiality. And after you leave that room, you cannot discuss anything that was discussed in that section with a friend, with your spouse, with a member of your church, or with anybody because that confidentiality agreement will have been broken and then you will have broken the laws of the nation.
Right. And that is really important. Thank you for enlightening us about that. So how do
Um,
you address the concepts of informed consent and confidentiality with your patients? And what are the steps that you take to ensure that they fully understand their rights in these aspects and these areas?
they the concerns or the steps that I would take to let the patient or client or whatever know that they have. First thing I would tell them that mental health is a very sensitive thing in our nation. And many times people who have mental health, it takes a big bold step for them to come forward and say, I want to come and get treatment because society stigmatized them. So you want to make sure that the environment where they are with you, they feel comfortable and they feel that you are there for them and to help them. And you tell them, I am here to listen to you. I am here to give you the care. People will say, I'm here to give you the help you that I'm saying that help is not the professional word to use. I would say that I'm here to give you the mental health care that you need to have. And these are the things that I want you to know that the section here today that we are going to be going through, I want you to know your rights, that I will not disclose any confidentiality and information about you. I will not give up any information to any of your family members. not even to your spouse, except you authorize me. And I will also let them know the only time I will give information about you is that when I see and sense that you are a threat to yourself and that you are a threat to society to harm someone else, then I will inform law enforcement about what I observe in the section about you.
Yeah. And that is really important. Thank you for bringing out these points. And I'm just curious, when it comes to mental health, there's a lot of stigma, like you said. Um, and with the perspectives of Christianity and spirituality, how do you address the embarrassment and the shame that a client or a patient brings into the office? And how do you approach that? How do you make them feel that they're in a safe space?
Well, I usually it's good to make them feel that they're in a safe space when they come forward because it took them a while, maybe years, for them to realize that they have some sort of mental impediment that they want to come and talk with you. So when they come in to talk with you, just your welcome alone, the environment is you have a calm environment, you have a responsive welcome for that person and make them feel that, hey, I'm in a place where I am respected. I'm in a place where I will not be stigmatized by my mental impediments that I am going through. I'm in a place where this doctor or this person, their, their human spirit makes me feel comfortable. Because the first thing you do is say, hey, how are you today? Say, man, I like that shirt you're wearing. Oh man, the sun is hot today. It's bring out a conversation, make them feel safe, make them feel that they can talk to you. And then you get into everything and be able to tell them what the process are and how long this section is going to be, and make them to feel that when they leave from this room that they will say, wow, I want to go back. I trust him or I trust her.
Yeah. Yeah, that sounds really important in the mental health setting, to say the least. And I'm just curious to know, so what are the key rights that children and adolescents have in mental health care, and how do these differ from the ones that adult patients have?
The key rights that children and adolescents have, there are several rights that children and adolescents have in mental health care, including access to care. And also, children have rights, quality mental health treatment in adolescents. You also they also have respect and dignity, not because they are children. And it goes to even adults also. You want to treat them with respect and with the dignity and let them know that these are the rights that they have, even though they have come for treatment, but you have to make sure that they understand that they themselves have rights and that they can tell you what they need and what they do not want to do.
Yeah, no, I hear you. Thank you. Um, Dr. Barr, your recent book called The Effects of Divorce on Children Under the Age of 18 has been quite insightful for anybody to read. So, what inspired you to write that book, and how does it address the topic of patient rights for children and adolescents in mental health care?
Well, I love that. I see you smiling. That means that you have read the summary or started reading my book. I tell you, my personal life inspired me to write this book. My parents got divorced, and I grew up in a home with just my mother. And every time I talk about it, I get emotional because I was just a week old when my father separated from the marriage between my mother and him. Unfortunately, he's dead. And I want to say that I said that the other time in an interview that I have forgiven my father because you have to forgive to be able to move forward. And I did not know that divorce had effect on children under the age of 18 until I went to school and I was in my after I did the first degree and started my undergrad degree. As you see, I did a few undergrad degrees in psychology and specialized in different areas. When I did my psychology and specialized in Christian counseling, and I came across this because I had an assignment, and I was like, "Does divorce affect children?" And I was like, "I am affected. My brothers are affected. My sister is affected." And I started to do research and I wrote a 20-page paper. And I said that I will write a book because if I did not know, a lot of people here in the US and around the world does not know that divorce have affected them. And I am very passionate about it. And I'm telling you, I talk about in the book uh, about marriage, what marriage is about is between a man and a woman. I talk about the biblical context of marriage. I talk about how religious institutions have failed to talk about the biblical essence of marriage. I talk about how millennials does not take marriage to be a sacred institution. It's like a mere contract. I talk about the worldview of marriage. I talk about the worldview and social view of marriage. And then I went in deeper and talked about the psychological effects that divorce has on children. And what I did after I talked about it in general, I broke it into two parts and talked about the effect that on girls. It divorce has a mental health component because it destroys the mental health of the mother. It destroys the mental health of the children. The children goes astray. Sometimes we see children in society misbehaving, but we in the society we live in now, we are quick to judge people. But it's good to know and go and deeper and know where they come from. And then you will realize that there is a mental impediment that is causing this problem. And because of divorce, it makes girls to be promiscuous. It makes girls not to trust any man when she gets into a adulthood and has a relationship. Girls draw closer to their mothers, and the mothers become their best friends. And guess what? They are disappointed in their fathers because they feel that the fathers betrayed them, and left their mother. And girls out there are looking for love because there was no man in the home to show them that fatherly love. And they are going, and because of that, promiscuity starts. And the boys also turn to drugs. They turn not to want to continue their education. They come to see that the same thing their father did to their mother, they can do it to anybody because they feel that it's a good thing. And I'm telling you, I have marked divorce as a virus. Divorce is a virus, and I will add today and say divorce is a mental health virus. Because sometimes after divorce, the women does not get over that divorce. They are mentally destructed. And I think that people needs to really get help after divorce or even before divorce takes place. I think that we need to start to encourage married families to see when the problems are developing that we can go and get help. We can get counseling.
Yeah, thank you for sharing that. And I hear that it is a very well researched book, and you've used very strong words like, calling divorce as a virus.
Yes.
And could you share some more insights from your research, especially on children, or children under the age of 18, and how it affects them adversely?
Yeah, it affects children under the age of 18 because daddy is not in the home anymore. And daddy is gone about his normal business. Mommy struggles to raise the children. And sometimes there will not even be a meal to eat, or if you do get a meal, maybe it would just be a meal for just a day, not 3 times a day. And children cannot get the basic things that a child needs to have when he or she is growing up. And that puts that child mind into a mental state of depression, into a mental state of shutting down, into a mental state of seeing other children with their both parents, and that they wish that they had that bond. I always said when I saw my friends growing up and I saw them with their father and their mothers together, I was like, wow, I wonder how it is because I did not experience it. But I tell you, my mother is my father and she's my mother. She took care of 7 children with a meager resource salary, and she deprived herself just to make sure that we become good children for the future. And I tell you that she always said to us, I have nothing to give you guys, but I will make sure that I will teach you about God, and I will make sure that you guys will get your education, because when you are educated, nobody can bluff you. And she said, it's not because your father is not here that you guys cannot be somebody good. And guess what she always did to us? She always told us, don't hold nothing against your father. Forgive your father because I have forgiven him. She never one day bad mouth him. And I want to tell mothers out there, when things like this happens, put your eyes on God first. Go get the help for your own mental strength and encourage your kids. Let them know that divorce, children who have gone through divorce, with their parents have gone through divorce, can tomorrow become president. It happened. We saw it with our eyes with President Obama. His parents got divorced, but he never allowed the effects of the divorce to keep him back. He persevered and he became the president of the most highest office in our country and around the world. He's well learned, and that's what motivates me. Before my father died, he asked me, we're at a funeral, went to the interment. He said, I see you getting all of this degree. He said, and he was well educated. He said, I want you to promise me that you will get your doctorate degree. And I said, yes, I will promise you. And I told him, I said, I will get a PhD. He said, that's what I'm talking about. Because perseverance and putting God first, you can get where your parents wanted to get, but they were not able, but you can get there and push the family forward.
Yeah. Thank you so much for sharing that, and that special message for the mothers
Yes,
who are watching you currently and who feel inspired to reach out to you. Thank you so much for writing that book.
you're
And
welcome.
we appreciate you being here with the National Library of Patient Rights and Advocacy and sharing your insights with us.
You're welcome. And the book is on Amazon. It's a 5-star rating book. The book is on Kindle. It's on iPad. It's on Reader House. It's on Google Play. It's on Apple iTunes, Apple Books. It's on Walmart.com. If you know if Walmart is carrying your book, then you should know you got a very good book. Walmart is carrying the book also on the website, and the book is on every platform around the world. And the book is a 5-star rating book. Barnes and Noble is carrying the book. And I want to encourage everyone out there. The book has paperback, it has an ebook, it has a hard copy, and an audio book. I want to encourage everyone out there, even if you are not divorced, but get a copy of my book and read it and share with your children. Because if we look in our society now, the institution of marriage is declining. And when God created the world, after he created the world, he created Adam. And after he created Adam, he created all the animals and gave Adam dominion over the, the earth and to name them. But every time he came to visit with Adam, he observed that Adam was lonely. He was alone, but he said, all the animals are paired out, but he who I made in my image is not paired out. And then he put Adam to sleep. And he created a helpmate. And he said in the book of Genesis, he said that he created bone of my bone, flesh of my flesh. He created Adam of the ribs of his wife. And I specify in my book, I said, there is a saying that everybody says behind a successful man is a good wife. And I said, no, your wife did not come from your spine. Your wife came from your ribs of your side. And on the side of every successful man, there is a good wife. And you two walk together side by side. And the Bible says that your wife would be compatible. But now in our society, when divorce comes, it says incompatible or incompatibility. I want you to buy the book. I want to encourage you to read the book. This book will open your eyes and you will see what divorce does. And I want to encourage all mothers in the United States and around the world. Make sure that when the family is shaking, talk to your husbands and go for counseling. I would advise that you go into Christian counseling because you will get the root and you will see what God can do.
Thank you so much. And we
You're welcome.
appreciate your time and being here. Thank you so much.
You're welcome. Thank you too for having me. I appreciate it.